Hello, my name is Lee, and I'm making this video to help all of you who are curious about the surgery they're about to go through. Like I was, I watched dozens, if not 100 videos on the surgery, the recovery, what to expect, because I'm one of those guys who wants to know what I'm about to go through. So today is actually 2 days since surgery. Yesterday, quite honestly, was unexpectedly brutal. The nerve block wore off at about 6:30 in the morning, yesterday morning. So that means it lasted about 20 hours. They said 18 to 24, so they were right on with that. Once the nerve block wore off, I felt some tingling in my fingers, and I could feel the sensations coming back. And by the time it wore off, I wish I had started taking the pain medicine sooner. And by the way, for those of you who are nervous about taking the nerve block, my advice is do it. I was one of those guys who was skeptical about taking the nerve block because I didn't know how I was going to feel with my arm numb, knowing it's there. I know I can play mind games on you sometimes. So I was a little bit skeptical of doing it, but after speaking with the surgeon and anesthesiologist, they both suggested that it's not going to be as bad as I believe it could be, and they're gonna I'm gonna be thankful that I had it, and they were 100% right. So the nerve block itself is a little bit intimidating, honestly, and like I said, I'm one of those guys who wants to know what I'm in for. That needle was quite large. It was a little over 3 inches long, and the syringe itself, I don't even know how much medicine it had in it, but it was quite large. I called it a horse needle. So they stick that into your neck, right into a space using ultrasound, and they try to pinpoint where that needle's going to hit so that it only puts to sleep the upper arm, the shoulder, and the lower arm, so that you can still feel your fingers to an extent. And that helps with the mind games that it could play. So I got that nerve block, and then it takes 20 to 40 minutes for that to take effect. And they start with a topical anesthesia. They just give you a couple of needles, kind of like if you're going to the dentist, and that numbs up the immediate area, and then they stick the nerve block in. So that's a little bit nerve-wracking, but once it starts kicking in, you're thankful that you had it. So then they take you into the operating room, and it's very cold in there, and it reminds me of a time I had surgery 20 years ago, and still the same, ice cold in there. They moved you onto the operating table, get you all situated, and then they give you sedation, which you won't even recall when they start the sedation. And once that kicks in, they'll lay you back to get you intubated, and then they sit you up in what they call the beach chair position. So you're going to be sitting kind of like I am right now, and that's how they do the surgery. I believe they pull your arm straight up into the air so that your shoulder's right in front of the surgeon, and depending on what kind of surgery you're having, that will determine where they put the portals. And and I guess I should speak about that a little bit. I had arthroscopic rotator cuff repair. In my case, my supraspinatus tendon, which is the tendon on the top of your shoulder, it seats onto the footprint of the ball of your shoulder. Mine was a full thickness tear, and I also had some fraying and strain on the bicep tendon. All of this was due to a fall off of a ladder. I'll never do that again. So I had to have a rotator cuff repair. because in that fall I dislocated my left shoulder, and that was what caused the tear. So in my case, I had an arthroscopic rotator cuff repair of the supraspinatus tendon and a reattachment of the bicep tendon. So as you see here, I have what's called a Breg Polar Cube ice pack. That is a device that you put on your table, and you fill it with ice and water, and it pumps ice water through that tube into this bladder that sits on your shoulder, and that's a pain reliever in itself. So I also have what's called a Joy Ultra Sling Pro, which is an abduction sling. I'll be in that for 6 weeks with 24/7, with the exception of taking it out for rehab and some occasional rotational movements, what they call passive and then active range of motion. And that's all under the advice of your physical therapist. You don't want to do it on your own, because you don't want to re-tear what you just got fixed. So that's what I have. And day 2 is much, much better than day 1. And day 1 after the surgery was quite painful, and, unexpectedly painful, actually. But when they called me, when the hospital called me yesterday to check on me, they told me that is what they call the hump day. Hump day is the first day of surgery, first day after surgery, when all of the pain meds wear off, and you're on to the prescription medicine. So, but like I said, day 2 has been much, much better. I've only taken one of the oxy pills this morning when I woke up. The rest of it's been Tylenol and ibuprofen, and so and I don't feel like I need any more oxy at this point. So day 2 was much better, and I will write again, or I'll create another video tomorrow or Friday with updated progress. Thank you.